In part 6 of the treatment module, we're going to talk about surgical options. The mainstay of therapy is penile implant. These are basically devices that can be inflated to generate an erection. There are also some rigid ones that are permanently, as it implies, rigid. There's also revascularization. This is basically repair of blood vessels. This is often indicated if there's been some prior trauma, pelvic trauma, car accidents, gunshot wounds, things like that. The surgeon will go in and repair these blood vessels and reestablish some connection to improve the blood flow to the penis. Venous surgery, as I mentioned to you previously, blood flows into the penis. The veins sort of clamp down and keep the blood there to maintain erection. Sometimes those veins leak. And it used to be quite a common surgery, but it really hasn't shown any long-term success and has really fallen out of favor for the vast majority of people. So implants are beneficial. For example, a person has prostate cancer and surgery and the nerves are damaged during the process because of the cancer being extensive, or maybe a nerve sparing procedure wasn't indicated or performed. It's important to note that a lot of these people do not respond to the Viagra and Cialis type medications, and an implant is certainly a viable option. There's two types, as I mentioned, the semi-rigid and the inflatable. They're really well accepted, and I know it sounds like a traumatic experience to have your penis operated on, but patients who undergo this procedure, greater than 80% of those experience sexual satisfaction. They enjoy the performance of the device, and it really has the potential to impact their sexual life as well. And there was one study, it was interesting, even though some of these patients had damage to their nerves from cancer and other issues, they noted that if a PDE5 inhibitor like Viagra or Cialis or Levitra, something like that, was used along with the implant, it really heightened their sexual satisfaction. There's a variety of theories about why that is, but just keep that point, make note of it if you're considering a surgical option for treating sexual dysfunction. Now, in the previous section, I talked about vacuum devices, and here's where the science comes in. The surgical study noted that people who used a vacuum device for a month prior to surgery really had better outcomes. They had better distensibility and stretching of the penis, and potential improvement in size and overall improved success from the implant device itself. Again, the use of PDE5 with implants may enhance overall function. There is some controversy about that, but I think for the right person who doesn't have any contraindications, it's certainly well worth exploring that option to heighten sexual enjoyment. So the complications, if you took the quiz, this was one of the questions in there. There's really low rate of complications in this procedure. The penis has a lot of blood flow to it, and areas of the body with high blood flow generally have less risk of infection. Antibiotic-coated devices are used. That also certainly helps. Erosion, this is more common with the semi-rigid devices. They can erode into the urethra where the urine travels, or, heaven forbid, erode out of the penis itself. Very rare complication. Occasionally people experience painful erections with this device. The inflatable ones, obviously, that's easily amenable. Just deflate the device or deflate it to a certain degree, and that can mitigate that problem. The overall rate of problems is really low, though. It's about 2%. So considering surgery in general, that's pretty low, and obviously depends on the type of device chosen and the skill and expertise of the surgeon placing the device. We've got one more section to go. The last section is on the cutting edge and emerging science of treating sexual dysfunction. There's some fascinating stuff. I think you're going to really like the last section.